So slowly we've been able to really build that engagement, and now we're seeing significant results in the work that we're doing in the community. So thank you to so many of you who participated in this in the Census 2020 campaign. I was fortunate to be one of the leaders. I actually, with our team, wrote the proposal for community outreach that brought $1.7 million for community outreach to the county. Worked with United Way and hundreds of other collaborators to do this really important work around census. And one of my very favorite programs that we started very informally, and it just grew and grew and grew, was our Cultivando Liderazgo program, nurturing leadership. We actually developed a curriculum in which we combined US history, a political science class, with Chicano studies, and tied it to the civics test for new citizens. And so we began to think through how we could expand this education. So essentially, we've been teaching a citizenship program for the last 5 years, pretty much nonstop, at least once a week, teaching US history, teaching how government works, the importance of civic participation. We meet once a week, and we were able to continue meeting with our groups even during COVID. So this is a program that we launched in 2015, and right before the COVID shutdown for us, I had a class of close to 150 students of all ages showing up to attend class and to learn US history and government, and helped over 2,000 people become citizens in that period of time. Many of them continued to be involved and are still attending virtual classes. So this is our great program. And so, of course, we are also very concerned with other necessities in our community, as I'm sure you've been reading about, and you know how hard COVID hit our community. The Voice of San Diego did a great series, like really walking people through that impact and what it looks like. And so, of course, the hardest hit communities were Latino immigrants. That's not surprising given that we are such a large sector that is involved in everyday sort of essential frontline work in agriculture and food industry, restaurants and all these different areas that many of them didn't shut down, like sort of all the other professions. So we noticed right away that one of the immediate impacts that COVID had was in regards to food insecurity. So access to food has been really important. We continue to work with partners like Feeding San Diego and local clubs, for example, with the San Marcos Democratic Club, through their service committee, we were able to partner to do monthly food drives, and then we distribute to communities and family members who are in great need. We do have some set distributions, like out in the Pama area, where we have the largest concentration of farm workers, many migrants, and so on twice a month, Feeding San Diego goes out there. We have community volunteers who do the distribution. So this has been going on for about 10 years, and that work continues. So with the food drive, we've been very strategic and very intentional about the kind of food that we solicit. We want to make sure that it's items that are culturally, appropriate, that people are actually going to use. So the most popular items, of course, on our list are beans, rice, maseca, salt, sugar, cooking oil, just very basic necessities. And our community members essentially do the collection with the club here in San Marcos, and then the distribution as well. So this continues, but it really picked up during COVID in response to the need in the community. We have also been doing work around just health and wellness, and reminding our community, like tapping into the historical memory of ancestral knowledge that we think is really important given the history of food in the Mexican Latino immigrant community, and kind of going back to some of those traditions that are very healthy. Many of them have forgotten, and I'm sure you are very familiar with the paradox that immigrants, especially Mexican immigrants, when they first arrive to the United States, are actually very healthy. The longer we live in the United States, our health declines. And so that kind of reminding ourselves of what we can do and things that we have control over to improve our health. But as I was mentioning earlier, what we've been doing, especially for the last 12 months, has been response to COVID-19. Since March of last year, our team of about 120 community members and volunteers, we've been out on the field at nurseries, at farms, at churches, at community centers, at the Escondido World Marketplace. We first partnered with county's operation collaboration comprised of CAL FIRE, so firefighters that were deployed to go out into hard to reach communities. We've been out on the field with them, doing a community education, providing masks, talking to people about safety guidelines and workers' rights. And so with this work, we've been out in the front line right along all the other essential workers. We've helped to vaccinate over 25,000 immigrants, farm workers. We're collaborating with our local community clinics like Neighborhood Health, Vista Community Clinic, True Care, and really pushing for equity in the vaccination strategy. And so we are hoping to continue to do this work. We had thought that we would wrap up, in 2021, but as we see with the new variants in particular, our work continues. We are at vaccination events essentially every weekend on Saturdays and Sundays, making vaccines available to farm workers and essential workers and everybody who needs a vaccine and wants one. We've been there along with our community partners to support. We are very much interested in continuing to work around youth empowerment, building that program to facilitate opportunities for engagement. We do have a program where we work with formerly incarcerated individuals. My colleagues Flor Alvarez and Lily Serrano continue to do a lot of work around criminal justice reform. We have a correspondence program where we actually facilitate educational participation for individuals who are incarcerated. we developed a curriculum on Chicano studies, ethnic studies specifically for them, and have students in almost every prison throughout the state of California. And we also are looking forward to getting back to our leadership programs where we bring democracy to life by taking students to Sacramento, to Washington, D.C., to see how decisions are made at our state and our federal capitals. So this is work that we haven't been able to do the way that we were doing it before COVID. So it's been virtual and obviously very different. So I will stop here, and I'm happy to answer any questions that you have. I'll just conclude by saying that for me, the work that I've had the opportunity to do has been really a blessing. I've been able to work with my own family, my mom, my sister, so many of my own university and college students, and immigrants who, for the first time, are seeing what democracy looks like and how we can participate in it. Thank you for the opportunity to share some of our work with you this morning.
Thank you so much, Arcela, for your wonderful explanation. You've hit on a number of topics, and I think we've got a couple of questions. I'm going to take Janice's question. What are your primary sources of funding?
Yeah, so funding, of course, has been so important because I transitioned from an academic field. I have personal experience doing grant writing, which I did for about 20 years to support the National Latino Research Center. So when I was at Cal State San Marcos, I brought over $10 million in funding to the university to support some of the work that, was really groundbreaking 20 years ago. And we took that experience into the community setting. So we've been able to build partnerships with some of the local funders. We are still operating, at really limited funding now as a separate community-based organization, but we have had funding from the Leach Tag Foundation, for example. They've been extremely supportive of our work with Sharon Goodson. We've had some work that we've done with the state of California. That's been the bulk of our funding this past year with COVID response through the labor agency, the California Department of Public Health. And then we do have partnerships with the California Endowment, the Catalyst Foundation. So we are hoping to build our portfolio as we come out of COVID and begin to do some of the work that sort of concluded, during COVID. And funding is just such an important piece of this work. We've been very strategic in the way that we solicited our funding because we want to make sure that it's funding that really